Hi, Dr. Saxena here, and I've been talking about some things on intestinal health. And when I talk about intestinal health, I started this segment. I'll try to focus on more on the small intestines. Small intestines are divided in three parts. One is duodenum, jejunum, and ileum. So the thing is, you know about what is that particular thing. About you must have read in all your primary schools and all that. The primary function of the small intestine is absorption of the nutrients from the food, and one of the digestion of fats, carbohydrates, and proteins have begun with the see what happens once pancreatic thing, it passes from stomach to mouth to stomach to pancreas from small intestines it goes into that. So what you are doing, the digestion, the pancreatic secretes lipases, proteases, and amylase, and this digestion of fats, carbohydrates, and proteins has begun with the help of pancreatic enzymes. The food travels through the small intestine, and absorption of nutrients occur at various stages throughout its length. For example, the duodenum, the primary site of absorption of minerals. The jejunum is responsible for the absorption of proteins, carbohydrates, and soluble vitamins, and the uptake of cholesterol, fat, and fat-soluble vitamins occurs in the ileum. Uh, Jejunum for minerals. You have got duodenum for minerals. Sorry, jejunum. You have got some absorption of proteins, carbohydrates, and water-soluble vitamins. And whereas ileum, you have got uptake of cholesterol, fat, and fat-soluble occurs through the distal ileum. So the inside membrane of the small intestine is specially structured to provide an optimal surface area for absorption to take place. It is composed of a series of microscopic folds called villi and microvilli, which resemble tiny finger-like projections. We have already discussed about that. When the intestinal lining is damaged by chronic irritation with the infectious microbes or through food allergens or gluten or casein peptides, the villi and microvilli, they flatten out. It causes banding, and this reduces the surface area for the nutrient absorption. This is why people with chronic intestinal problems often suffer from malabsorption syndromes. So, besides its role in the absorption of nutrients from foods, the small intestinal lining also has the important function of acting as a barrier. This barrier is important because the toxins, unwanted substances such as toxins and harmful proteins from crossing the gut wall and entering the bloodstream. Under normal circumstances, this barrier will remain intact. When there is a chronic mucosal irritation, however, the intestinal lining will be compromised, and allowing greater amounts of this harmful products, substances to be taken up by the intestinal tract into the bloodstream. This results in a state of intestinal hyperpermeability, which we call it as a leaky gut syndrome, which is the most common manifestation in most of the chronic diseases. You take anything from allergy to cancer, you will see hyperpermeability of the small intestines is the major cause of it causes immune issues. It causes all this toxicity to enter into that. That's the reason we try to be very careful whenever we work on this. We try to work on how to see that the small intestinal function gets better, that leaky gut or intestinal hyperpermeability is to be our first focus is on that particular thing. So that's the reason we try to avoid one thing which is called food allergens. We tell the people not to go for gluten. Casein is found in milk, gluten is found in the wheat and wheat products, and milk, and all these things are debarred. In the sense, we try to consciously tell the patient not to take all these things unless the intestinal permeability is restored. Then you can always go for it. because this is one of the major kind of stuff with which a lot of problems happen. So we work with some therapeutics, we try to work with some other areas also, but the needless to say, if someone is not interested in stopping his milk or stopping his wheat and all that, we cannot go further. We have to we try to work. This is one of the things which it has to be a, it's important for this hyperpermeability, intestinal hyperpermeability. If it persists, it doesn't allow, you cannot get better, you cannot optimize your health without correcting that particular stuff. So this is one thing with the small intestines, which I always believe that you have got host of other things, and everything has to fall in place. You need to work it out with a good bacteria, try to work out with the fungal elements and all. We try to see that the diet also is properly optimized. So this is how we try to work it out with the small intestines. Thank you.